Welcome back to Every Woman, and there's a controversy brewing in men's health with prostate cancer and screening. So we have Dr. Jennifer Liu, urologist, to come answer a lot of the questions that are going on. So there's controversy as far as if men should get screening for prostate cancer or not. Can you clarify that a little?
So the United States Preventative Task Force, they're the people from the government who are a board of primary care physicians, nurse practitioners. They look at studies kind of globally, just trying to figure out what's right for men and women, whether it's colonoscopies, mammograms, and in this case, for prostate cancer. So last year, they came out with a recommendation saying that we should not be screening men with the blood test prostate-specific antigen to look for prostate cancer because they think that the risks outweigh the benefits.
And do you agree with those?
Oh, well, no. In fact, the American Urologic Association, our governing body, came out strongly against the task force recommendations because there were no urologists, no oncologists, or radiation oncologists on the board, and we're the people who treat people with prostate cancer. So, you know, the American Urologic Association came out very strongly against it, and in fact, the task force will be reviewing their recommendations based on recent studies.
Does the screening matter as far as what the man's age is?
Absolutely. In fact, you know, our guidelines state that men under 40 should not be screened for prostate cancer. Men 40 to 54 need to have a talk with their physician about whether or not they should be screened. You know, the high-risk patients from 40 to 54 are men who are African American or men who have a family history of prostate cancer. And then the most benefit is actually for screening of men between the ages of 55 and 69. You know, that's the group that we think should be screened.
What about the men in my generation? Before they have to go to these screenings, what should they be doing? What should I be encouraging, you know, my brother or my boyfriend to be doing?
Like lifestyle or food or, you know, something that would make your situation better.
You know, truth be told, they've done a lot of studies to look at things like selenium, saw palmetto. There's some people who believe that animal protein causes prostate cancer. And in fact, none of the studies have come back conclusive. So the most important thing for men of all ages to know are just to know your risks. Discuss with your doctor whether or not you should be screened, and in fact go to the doctor, because most men actually just don't want to go to the physician.
Taboo, yeah.
And there's an increase, though, in the number of men now as opposed to 50 years ago? Or
no, in fact, the incidence of prostate cancer is the same, and
Really?
that's one of the reasons why people believe that maybe we shouldn't be testing. We're finding more cancer globally speaking, but obviously our population has enlarged.
And is it just because we're just that much more aware?
Yeah, that's part of it, and because of PSA and digital rectal exams, we have found more, but we're not saving more people,
Right.
and that's why, you know, people are saying maybe we shouldn't do it, because the same number of men die every year from prostate cancer, and that's been pretty much the same. But newer studies are showing that we actually are hopefully saving men, but you know, we're still kind of in the midst of all these tests.
So if you're over 70, then you wouldn't even worry about it,
right.
basically.
You know, the recommendation is not to screen men over 70s, particularly if they don't have a life expectancy of 10 to 15 years.
But they're going to have some kind of prostate issue if they get to a certain age.
Right, and that's where a lot of...
Wait, all men are going to have some sort of prostate issue?
Well, yeah. Well, I think of it as nature's way of making up for women's issues.
That's right.
Right,
Well,
yeah.
that is sweet justice, and we thank you so much, Dr. Liu, for coming here and educating us about
No problem.
this. And we'll be back with more Every Woman.
Okay.
I didn't realize that.
Yeah.